Have you ever tried to read a research study and just felt your eyes glaze over? Yeah, you're definitely not alone. Today, we're going to crack the code on one of the most important ideas in all of research, variables. Seriously, once you get these, everything else starts to click into place. So let's dive in.
So think about a question like this. It seems pretty straightforward, doesn't it? But if you had to actually test it, how would you do it? How would you measure it? See, at the heart of this question are two key factors, and these are the things we need to investigate. These are our variables, and learning how to spot them is your first step to thinking like a real researcher.
So here's our game plan for today. We're going to start with what a research question even is, then we'll get to know our key variables. After that, we'll learn a super simple rule that connects them. We'll put it all into practice with some real-world examples. And finally, we'll talk about why this one skill is an absolute game changer.
You know, every single study, from a small classroom project to a massive clinical trial, it all starts with a question. You can think of researchers as detectives, really. They're just trying to understand the relationship between different things out there in the world. They want to know if one thing might cause, or is at least connected to, another.
And those things they study, well, we call them variables. And the name really says it all. A variable is just something that can vary or change. It could be literally anything. A patient's blood pressure, a new medication, a person's stress level, their age, you name it. These are the basic building blocks we measure and observe in any study.
Now, to really understand a research question, we have to identify two main types of variables. Think of them as the two most important clues in any investigation. You've got the thing that might be causing a change, and then you have the change itself. Let's meet our two key players.
First up is the independent variable. This is our main suspect, the presumed cause. In an experiment, this is the thing the researcher is actually changing or introducing just to see what happens. It's the new nursing intervention, the specific therapy, the educational program. It stands on its own. It's independent.
And of course, where there's a cause, there's usually an effect, right? And that's our dependent variable. This is the outcome, the result we're measuring. Its value is thought to depend on whatever happened with the independent variable. So if we want to know if a new study method works, the test scores of the students would be our dependent variable. Make sense, right?
All right, now for the golden rule that just ties this all together. It's a beautifully simple way to think about this relationship, and I promise you, it's going to be your secret weapon for breaking down any research question you ever come across.
It's this simple. The independent variable is the cause. It's the action. It influences a change in the dependent variable, which is the effect or the outcome we measure. So when you're reading a study, just ask yourself, what's the action being tested, and what's the result being measured? Okay, theory is great, but let's make this real. We're about to look at a few research problems pulled straight from actual nursing studies. For each one, I want you to use that cause and effect rule we just talked about and see if you can spot the independent and the dependent variables. You ready?
Okay, here's our first case. We're looking at the effect of mindful meditation on post-surgical pain. So take a second. What's the intervention here, the thing being introduced or tested? And what's the outcome that's being measured?
Nailed it. The cause, the action being introduced, is the mindful meditation. That's our independent variable. The effect we're measuring is the level of post-surgical pain. That's our dependent variable, because the whole idea is that the pain level depends on whether they did the meditation. See how that works?
Awesome. Let's try another one. This time we're studying the effect of activity level on body weight. Which one is the cause, and which one is the effect? Which one is doing the influencing? Exactly. The activity level is the independent variable. That's the factor that's changing from person to person, and it's the one we think might influence the outcome. The body weight is the dependent variable. That's the outcome we're measuring to see if it changes based on how active a person is.
Okay, one final case, and this one is super common in clinical practice. We're trying to see if changing a patient's position every hour can help prevent pressure ulcers. So apply that cause and effect rule. What's the nursing action and what's the patient outcome?
That's it, you got it. The independent variable, our cause, is the intervention itself, that hourly position change. The dependent variable, the effect we really care about, is the incidence of pressure ulcers or how often they occur. So we've had some good practice spotting variables, but you might be thinking, why is this such a big deal? Well, because this isn't just some academic exercise. This is where research meets the real world, especially in a field like nursing.
Here's the bottom line. You can't really critique a study's findings if you don't first understand what question it was trying to answer. Identifying the independent and dependent variables means you found the absolute core of that question. This isn't just a skill for passing a test, it's the foundation of evidence-based practice, letting you decide which new research should actually change the way you care for patients.
And that's really the whole point of all this, isn't it? Every time you spot the variables in a study, you're tapping into this much bigger purpose. You're looking at a piece of the puzzle that was created to ultimately improve patient care, to make nursing education stronger, and to lead to better health outcomes for all of us.
So, you've cracked the first part of the code. You can now confidently look at a research problem and pull out its most important parts. That is a huge step, but it also opens the door to so many more questions, right? Think about it. How exactly did they measure those variables? Who were the people in the study? Was the study even designed well? Spotting the variables isn't the end of the journey. It's really just the beginning of thinking critically about the evidence that shapes our world. Thanks for tuning in.